So, what is the Devon Advocacy Consortium?
Okay, Devon Advocacy Consortium is a consortium of charitable organisations that have come together to provide advocacy services for people. So it consists of Living Options Devon, who provide advocacy for people with disabilities and also people who are deaf, Vocal, who provide services for people with learning disabilities, Rethink, people with mental health conditions, Young Devon, who focus on younger people, and Plymouth and Devon Racial Equality Council, who provide services for people from ethnically diverse communities.
And what services do you offer?
We offer a range of different advocacy services. So for people who've been detained under the Mental Health Act, they're entitled to an IMHA, which is an independent mental health advocate. We provide IMCA, which is Independent Mental Capacity Act advocacy for people who need support with something like a change of accommodation or serious medical treatment where they lack capacity to make the decision for themselves. We provide what's known as litigation friend and paid representative services. That's for people who might be within residential care settings or a hospital setting who need someone to support them where there's been a deprivation of liberty authorisation because they're felt to be at risk because of their condition. We also provide Care Act advocacy, and that's supporting people who might be having a review of their care package, an assessment of their care needs, or need help with a care and support plan. We also take complaints about NHS services, and it's important to emphasise that it's just NHS services and not social care, and also that particular service just covers Devon and not Torbay, whereas the rest of our services are across both authorities. That's something that's also picked up by our partner Rethink, who will either provide people with an advice or information pack, or in some circumstances people might be entitled to an advocate.
So, what are the benefits of the consortium?
I think the benefits are that the consortium brings together a range of advocacy providers with different focus, different skill sets, able to meet people's individual needs. So, for example, can communicate with people in a variety of ways. So, for example, talking mats, pictures, easy read, different ways of engaging with people. Also, the different advocacy partners are able to share training, to learn from each other, and to bring together different skill sets, to make sure that the service that's provided meets the needs of the individuals.
And how do people refer to the service?
So the single point of contact is a small local, based in Exeter, team of referral coordinators who will take self-referrals and referrals from other agencies and forward them on to advocacy partners. In some circumstances, the referral will not be appropriate for Devon Advocacy Consortium. Just for example, we don't take queries regarding housing issues or benefits issues, but what we always endeavour to do is signpost someone onto agencies that are more appropriate to help them with their particular issue.